Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey guys, welcome back. So in the last episode, we talked about female reproductive organs and body parts. And so that's what we're going to do today, except for the males. So the male sexual organs and erogenous zones, we have the penis, the scrotum, the testes, the prostate, the vas deferens, the urethra, the epididymis, and the seminal vesicles. So let's dive right in with the penis. The penis provides the erection for penetration and masturbation. It has two blood vessels. They're called the corpus cavernosum, and they are covered in the tunica albuginea. They also have the dorsal nerve, artery, deep arteries, and the urethra is surrounded by the corpus spongiosum. The two blood vessels are what gets the penis erect. Okay, they communicate with each other, so blood flows throughout the penis, goes through these two. That's what gets engorged. That's how you get the erect penis. So it fills the corpus. The dorsal veins dilate, the deep arteries increase, the urethra decompresses so that the penis becomes as full of blood as possible. The glans of the penis is the most sensitive area of the male erogenous zone. So just like the clitoris was for the female, the glans, the head of the penis, is for the man. For the penis, guys, you get what you get, okay? Whatever your size is what you are. And let me tell you, I've seen all kinds of sizes, all different colors, and every single one of them has sex. So relax. What you got is good. You're going to find the partner that works for, that you like it, they like it. You could be too big for somebody and too small for the next person. It doesn't matter. You have what you have. There are fillers. I'm not sure that that's really a great idea, but you're going to hear about them. But there is no way to elongate your penis. We do not have anything for that. Don't waste your money on pills that tell you it's going to happen. It's just, you have what you have when it comes to your penis, okay? All right, scrotum. So the scrotum is your sac. It holds all the stuff, okay? So you have the testes are in there. They produce and store the sperm. They also produce and release testosterone and other hormones. Okay, you have the epididymis. The epididymis stores the sperm until they mature. Infections can occur in the epididymis, so that would be epididymitis. We see that frequently. It's painful, but it's easily treatable with some antibiotics. So if you do have pain in your scrotal area, specifically if it's one side or the other, go get that checked out. We can do an ultrasound. We can get you treated very easily. The vas deferens moves the sperm from the epididymis to the ejaculatory ducts. The vas deferens is what we cut when we're doing a vasectomy and giving you that sterility that you desire, and is a fantastic way of preventing pregnancy. Although it is not 100% and you can have a post-vasectomy baby, it does work very well. The spermatic cord moves the sperm to the urethra for the ejaculation. The seminal vesicles make fluid that goes with the sperm for the ejaculation, which is called semen. And also with the scrotum, you have the cremasteric muscle, which moves the whole scrotum closer to the body or further away from the body for temperature regulation. Sperm production is a very testy. See what I did there? And so the scrotum has to move up and down to keep the testes in a specific temperature range so that they can produce good, healthy sperm. Inside the body, you have the prostate. So the prostate is between the bladder and the penis. So the urine does pass through the prostate, through the urethra, and so does the semen. The whole life purpose of a prostate is to add fluid and propulsion to the ejaculate. So it is an accessory gland. It does have a mechanical shift between urine and ejaculate. In the prostate, you can have both cancer and infection. So cancer is usually later in life. I have seen it in men in their 30s and 40s, but that's very rare. Most of the time it's 50s, 60s, 70s. We do stop testing for it between 75 and 80 based on the current guidelines, because the prostate cancer general rule of thumb is that it's a very slow growing cancer, and that the treatment for it is sometimes more detrimental and decreasing quality of life than dealing with the cancer, which has no symptoms. The prostatitis is an inflammatory response of the prostate, sometimes as bacterial, most often as just an inflammatory response. We treat it with antibiotics, but it can cause pain with urination, pain with ejaculation, and just kind of some discomfort or feeling of swelling in that area, especially when you're sitting. So avoid unprotected anal sex, avoid hot tubs, pools, open water, and just make sure that you are peeing if you're getting out of any of those situations to kind of push any bacteria back out through the urethra. Also, there is overgrowth of the prostate that can happen. It will happen in 99% of you guys throughout your life. It just gets bigger and bigger and bigger. We don't really know why it does it, but it does it, and it doesn't mean anything. It is not associated with cancer. But the overgrowth of the prostate can give you some urinary issues. So if you're having frequency, urgency, dribbling, waking up a bunch of times at night, and you're in your 40s or above, you might want to go get checked out by your urologist so that you can see whether or not your prostate is healthy or needs to have some treatment. The ejaculation frequency has absolutely no effect on the size of your prostate. However, it is associated with lower rates of prostate cancer if you ejaculate more often. So it's a 20% less chance of prostate cancer if you ejaculate 21 times per month versus 4 to 7 times per month. So get out there and have sex. It's good for your prostate and prevents cancer. So yay! Prostate stimulation can result in an orgasm. It is referred to the male G-spot. You can access it through the anus. You can massage it with a come hither motion or a doorbell motion or circling. Any of those can be very pleasurable if your male partner is willing to have that done. You can also have anal sex to hit it, either with a penis or a toy. Depth, pressure, vibrations, and sensations certainly are to the receiving person's liking. But it can be a very strong and intense orgasm if you do have a prostate orgasm. Other erogenous zones, the anus. So a lot of men will like fingering, licking, or insertion of a penis or a toy into their anus. There's a lot of nerve endings at the anal sphincter, and that can be very pleasurable, as well as we just mentioned the prostate's inside the anus, so that can be pleasurable as well. Other male erogenous zones, much like we mentioned for the female, it could be the inner thighs, the ears, the necks, the perineum area, which is sometimes referred to as the taint. So it's the area between the rectum and the scrotum. Their nipples, their neck, the back of the knees, the scalp. There's lots of different areas that can turn your man on. So just light touching, kissing, maybe some more rough touching or pulling of hair, something like that can be arousing as well. For men to get aroused, they can need both visual, touching, and sometimes fantasies to get that stimulation going and get the male erection. So visual can be in person, looking at your partner, or using porn or a video of some type. The classic question of, is a man an ass man or a boob man? This is where it comes into as visuals. All right, what turns you on? Okay, visuals are extremely important for male arousal. It definitely helps females as well, but it's very important to men. Touching. Where are you touching your partner? We just went over all these erogenous zones. That is really important for arousal for the men as well, to be able to get a good erection. The fantasies that can be in your head, that can be role playing with your partner, any of those things can be really helpful with male arousal. There can be issues with men getting aroused from trauma, physical injuries, birth abnormalities, erection issues, stress. There's so many different things that can go on. We are going to touch on erectile dysfunction in a separate episode. But the trauma issues, that could be sexual abuse, it could be a depression or anxiety, it could be just physical abuse, even if it wasn't in a sexual way, just being touched is very difficult for you. Physical injuries could be, I've seen a gunshot wound to the penis. I have seen someone fall on barbed wire and rip open their scrotum. And that took a very long time to heal, and there was some nerve damage there. So there was kind of some chronic pain that was going on there. Birth abnormalities of a micropenis or weird foreskin that is adhered and didn't get taken off well in a circumcision. Those things can have arousal issues, maybe some painful issues. Certainly, if the foreskin is causing issues, a circumcision later in life is always an option as well. Stress, if it doesn't even have to be with just that person, it could be financial stress, it could be anything to do with work or a really bad drive home during rush hour. Anything like that can cause you an issue for the day. So really kind of trying to gear in and focus in on what might be out of your normal for the day that might be causing that to be an issue for you. So some various areas. The male anatomy isn't quite as vast as the female anatomy that we went through in the last episode, but it's extremely important. It is extremely pleasurable, and we certainly need to help our guys out and get them aroused. It's time for my favorite segment of the show, Between the Sheets Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthe@gmail.com. Let's tell some stories. So I had a patient who had a history of sexual abuse. He was unable to get erections and really didn't even have a desire for intercourse. He had been sexually abused by a male relative when he was younger. And so as an adult, heterosexual male, even though he was interested in females, still the trauma that he had gone through as a child was really preventing him from being able to explore a fun sex life. So we got him in with a sex therapist. They worked through a lot of these issues, talked through the different traumas that he went through, talked through how to process those issues, how to kind of compartmentalize them when he needed to be aroused, and really worked through the damage that had been done. And now he has a fantastic sex life. He has a long-term girlfriend, and they are doing amazing and have been able to experiment and have fun in different ways. And he is very satisfied now. He's able to climax and have quality erections and all those good things. So sex therapy can really help work through some of those issues, whether it's abuse or otherwise. I had a patient back when I was a nurse that had a micropenis. I did not know this walking into the room. I was going in to put a catheter in. He was in urinary retention, and I went in and was kind of startled to see that. It was the first time I had seen that. But I was, very professional about it, put the catheter in and moved on. But it did lead to having some good conversations because the patient was very open with me about it and, was talking to me about that it has been a difficult thing for him and his wife. But they've been able to find ways because he can't fully penetrate her. He is comfortable in knowing that this is what he has and there's nothing he can do about it. They have gotten a strap-on dildo that he can wear, and so that he can still penetrate her, and it helps him feel like he's more masculine because he can penetrate, and it gave her more satisfying sex life as well. And he still climaxes with other ways, and so that's satisfying for both of them. He was also able to conceive biologically, which is helpful for anybody else who is dealing with having a small penis. That is still possible. You can still ejaculate and have that going into your partner in a way that they can still conceive. Another fun story, I had a friend who had their first prostate orgasm with a rim job, So they were getting licked. That's what a rim job is, if you're not aware of that. And then they started getting fingered while in the anus while getting a blowjob. And it took a little while, but he said it was the best orgasm of his life. He prefers that now more often than not. And it was a kind of circling motion for him that we talked about the various types of prostate massage. It was a circling motion that worked well for him with the blowjob and also playing with his scrotum. And that was a really great way for him to be able to experience a new type of orgasm. I have a friend who was not sure whether or not he would like nipple stimulation, had never tried it, wasn't necessarily opposed to it, but just didn't know. And his girlfriend really wanted to try that with him. And so he tried it and he was a little too ticklish. Didn't really work for him, didn't like it. It felt weird. But I have another friend who, same type of thing, wasn't sure whether or not he would like it, had a partner that was wanting to try it and see, and he loved it. In fact, he liked it to the point where when he was getting close to orgasm, he wanted his nipples sucked on, and that intensified his orgasm for him. So exploring through all of these erogenous zones is really a great way to figure out what gives you the best pleasure, as well as it's just fun between you and your partner to find new ways and new touching and exciting things to do to each other. So I think that this was a great way to look into the different ways and erogenous zones of the men and how you can give your male partner a really great event and session. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.